MSM is a powerful supplement and it can have many benefits. Research shows that it may be helpful in reducing joint pain, lowering inflammation, improving skin health, decreasing allergy symptoms, and speeding recovery after exercise. Additionally, some evidence suggests that MSM can boost the immune system and it may have cancer-fighting properties. Studies have shown that MSM significantly reduces inflammation in the body. It also inhibits the breakdown of cartilage, a flexible tissue that protects the ends of your bones in the joints. Doses can range from 5 to 30 grams per day. Detoxification symptoms can be noticed when first taking MSM. Therefore, you should start with a small dose and build up gradually until your body adjusts. One way to reduce the detoxification symptoms from MSM is to take vitamin C with it. This helps to bind up any toxins released through the increased cell permeability that the MSM produces. Vitamin C is a powerful antioxidant and it fights molecules that trigger joint inflammation. And vitamin C serves a role as a cofactor in collagen synthesis, which is the main protein in joint tissue and bone. The best form of vitamin C would be liposomal vitamin C, then a non-acidic form, with the worst kind being cheap, acidic ascorbic acid. Cissus quadrangulus, also known as veld grape, is a plant that belongs to the grape family. It's commonly used for bone health and for weight loss. It's also been used for conditions like diabetes, high cholesterol, hemorrhoids, and many other. The cissus has been shown to help to reduce joint pain and to relieve the symptoms of arthritis, a condition that's characterized by swollen, stiff joints. One 8-week study in 29 men with chronic joint pain found that taking 3,200 milligrams of cissus daily significantly reduced the exercise-induced joint pain. Magnesium strengthens bones. It maintains nerve and muscle function. It regulates heart function and blood sugar levels, and it helps to maintain joint cartilage. Magnesium bisglycinate would be the best form to use. In order to determine your dose, start to slowly increase until stomach discomfort or diarrhea is noticed. Then slowly reduce until you're able to determine your maximum tolerable daily dose. By splitting the dose into 3 portions for breakfast, lunch and dinner, you can also help to reduce any unwanted stomach discomfort. As magnesium is required by hundreds of enzymes in the body, supplementation can have profound benefits to many areas of your health after a few months of use. People who have low levels of vitamin D often have joint pain. Vitamin D supplements may treat joint pain in some people who have a vitamin D deficiency. By upping your vitamin D intake, it's been shown to help with the symptoms of rheumatoid arthritis. Vitamin D helps to absorb calcium, which is also essential for building strong bones. Too little of this vital nutrient can lead to having thin, soft and brittle bones, which is known as osteomalacia in adults and rickets in children. You can get a 25-hydroxy vitamin D blood test to assess your levels and then supplement accordingly with vitamin D3 to correct any deficiency. Vitamin D's action is also enhanced when it's combined with vitamin K2. Our bodies need calcium to build and to maintain bones. When it breaks down calcium in our bodies, vitamin K2 activates a protein that then helps the mineral to bind to our bones and to do its job. While research is ongoing, studies show a higher vitamin K2 intake improves bone density and it reduces the risk of bone fractures. There's evidence that vitamin K2 supplementation reduces inflammation in rheumatoid arthritis by reducing the CRP levels. Vitamin K2 may induce apoptosis in rheumatoid arthritis synovial cells. Low levels of vitamin D and K2 have been implicated in osteoarthritis. The maximum amount of vitamin K2 that your body can absorb is 300 micrograms per day. The best form of vitamin K2 is MK7. Calcific periarthritis is a condition that involves the painful swelling around the joints. It's known as a calcium crystal disease because the pain is caused by crystals of the mineral calcium rubbing against the soft tissues inside the body. This is one reason that people suggest that you only get your calcium from food sources, as over-calcification, mainly to synthetic or cheap non-food sourced calcium, can cause problems. Also, don't try to get your calcium from pasteurized milk, as the acidic state that consuming pasteurized milk can create can actually leach calcium and make matters worse. Instead, only use raw, unpasteurized milk, which contains valuable probiotics and enzymes and doesn't have the acidic denatured proteins that the pasteurization creates. Many people with arthritis take gelatin supplements. Gelatin contains collagen. That's a material in the cartilage that cushions the bones in your joints. The idea behind the usage is that eating the gelatin with the collagen will then add collagen to your joints. Collagen may have the ability to keep muscles and tendons together and even rebuild your cartilage. In turn, it may help to fight the symptoms of osteoarthritis. Collagen supplements rapidly absorb into your bloodstream. Your body will begin using them to rebuild collagen within an hour, but it can take a little longer before you can see the results. Doses of collagen can be from 5 to 30 grams per day. You can purchase animal or fish-sourced collagen. Glucosamine and chondroitin protect cells called chondrocytes, and these help to maintain cartilage structure. In theory, these supplements have the potential to slow cartilage deterioration in the joints and to reduce pain in the process. In most studies on treating osteoarthritis, the typical dose was 500 milligrams of glucosamine sulfate 3 times a day. Chondroitin is found naturally in your body. It's a vital part of cartilage, giving it its elasticity by helping it to retain water. Lab studies have found that chondroitin can reduce the activity of enzymes and substances that break down collagen in the joints. The typical dose of chondroitin sulfate is 800 to 2000 milligrams taken as a single dose. Joint pain, especially in the knee due to arthritis, affects about 1 in 10 older Americans. Research finds that an ingredient in the spice turmeric can significantly reduce the knee pain in people with osteoarthritis, but it won't improve the swelling or change the cartilage. This means it should be combined with natural anti-inflammatory and cartilage support for the best results. Doses range from 2 to 5 grams of curcumin turmeric extract per day. Due to curcumin's low bioavailability, its absorption can be increased by taking it with biopterin, which is a black pepper extract, or consuming it with a fat like coconut oil, butter, ghee, or fish oil. 1 to 3 grams of fish oil each day can help to reduce the intensity of joint symptoms like morning stiffness, tenderness, swelling, and discomfort. The omega-3 fatty acids present in this amount can also increase the blood flow through the body during the exercise, and this can help to reduce joint pain and swelling. Look for a molecularly distilled EPA DHA omega-3 fish oil blend. Avoid pro-inflammatory omega-6 like arachidonic acid. Metabolic acidosis is a buildup of acid in your body. Your kidneys help to keep the right balance of acid in the body. Your body can have too much acid for 2 main reasons. 1, your kidneys are not balancing or getting rid of enough acid. Or 2, your body is making too much acid. Metabolic acidosis can lead to acidemia, which is defined as arterial blood pH that's lower than 7.35. The only definitive way to diagnose metabolic acidosis is by simultaneous measurement of serum electrolytes and arterial blood gases. Many, however, use pH strips to test their saliva and their urine for an acidic pH. Metabolic acidosis may affect changes in bones by directly inducing the dissolution of the bone, stimulating osteoclast-mediated bone reabsorption, inhibiting osteoblast-mediated bone formation, and altering the serum concentrations or the biological actions of parathyroid hormone and vitamin D. It's for this reason a low carbohydrate, sugar-free, alkaline diet would be recommended if trying to heal joint problems. Boswellia is also known as frankincense. Boswellia comes from the Boswellia serrata tree, which is native to India, North Africa, and the Middle East. Boswellia is taken by mouth for brain injury, osteoarthritis, rheumatoid arthritis, joint swelling, swelling of the fluid pads in the joints, known as bursitis, and swelling of the tendons, known as tendinitis. It can be taken internally and also applied externally. Devil's claw is used for hardening of the arteries, atherosclerosis. For arthritis, gout, muscle pain, back pain, tendinitis, chest pain, gastrointestinal upset, heartburn, fever, and migraine headache. Research suggests that devil's claw may also help to relieve joint pain that's associated with osteoarthritis, and it may be as effective as the painkiller diurcerin. Cat's claw can be an effective treatment for osteoarthritis. This can help with joint pain, especially when taken with other anti-inflammatory herbs. Deer antler velvet contains over 300 bioactive compounds. It's been used for numerous health conditions for thousands of years. Next to ginseng, it's the most prescribed medicine in traditional Chinese medicine. Deer velvet has been used to reduce muscle aches and pains, improve the way the immune system works, and decrease inflammation. Deer velvet has also been used in people with osteoarthritis to reduce joint pain and to improve the function. Doses can range from 500 mg per day up to many grams. Be sure to buy whole powdered antler and not a deer velvet IGF extract spray. Deer antler appears to work synergistically with green-lip mussel. Due to its anti-inflammatory properties, green-lip mussel extract has been claimed to reduce joint inflammation, helping to relieve conditions like arthritis. Many cardiologists place their patients on CoQ10 to help cardiac function, as well as to reduce the bad side effects of statin cholesterol drugs. The supplement also can help to decrease the pain of rheumatoid arthritis by decreasing the bad inflammatory chemicals that lead to cartilage breakdown. Doses can range from 300 to 500 mg per day. The action of CoQ10 can be increased by combining it with PQQ at up to 40 mg per day. Both of these work by improving mitochondrial function. You can see my other video on mitochondria boosters for more information about this. For more information about the herbs or supplements mentioned in this presentation, check out my website.